Hello, I'm Dr. James Wilson, and welcome to Senior Vitality Clinic. Today I'm going to help you understand how to read your medication bottles so you can take your medicines safely and have better conversations with your healthcare team. This information is educational and should never replace personalized medical advice from your doctor. Did you know that medication errors cause over 100,000 emergency room visits each year among seniors? Many of these mistakes happen simply because people misread or misunderstood the label on their prescription bottle. If you've ever stood in your bathroom holding a bottle, squinting at the tiny print, and wondering, when exactly should I take this? Or, can I eat before taking this? You're not alone. These bottles contain crucial information that can mean the difference between getting better and experiencing dangerous side effects. Today, we're going to break down every single part of that label. I'll show you what each section means, why it matters, and what questions you should ask your pharmacist if anything is unclear. By the end of this video, you'll feel confident reading any prescription bottle that comes your way. This isn't about memorizing medical terms. It's about your safety and getting the most benefit from your medications. So grab one of your medication bottles if you have it nearby, and let's go through this together, step by step. Let's start with why this matters so much, especially as we get older. Why medication safety becomes more important. After 60. Most people over 65 take at least 4 prescription medications regularly. Some take 10 or more. Each bottle has different instructions. Each medicine works differently in your body, and here's what many people don't realize. Your body processes medications differently as you age. Your kidneys and liver don't clear medications as quickly as they used to. Your body composition changes. You typically have less water and more fat tissue, which affects how drugs are distributed. You may have multiple health conditions that each require treatment. All of this means that reading and following medication instructions correctly becomes absolutely critical. Common misconceptions that put people at risk. Let me address some dangerous myths I hear all the time in my practice. Myth number 1. If it's prescribed, I can just take it however I want. False. The timing, food interactions, and specific instructions matter tremendously. Taking a medication at the wrong time can make it ineffective or even harmful. Myth number 2. All the important information is on the label. Not quite. The label has essential information, but your pharmacist should provide additional details. Never hesitate to ask questions. Myth number 3. Generic medicines aren't as good as brand names. This is incorrect. According to the FDA, generic medications must have the same active ingredient, strength, and effectiveness as brand-name drugs. The main difference is usually cost. Myth number 4. I can stop taking it when I feel better. This is dangerous, especially with antibiotics and blood pressure medications. Stopping early can cause your condition to return or worsen. The real cost of medication errors. The Institute of Medicine reports that medication errors harm at least 1.5 million people annually in the United States. For seniors, the consequences can be especially severe. Taking the wrong dose can lead to hospitalization. Missing doses can cause your condition to worsen. Taking medications at the wrong time can reduce effectiveness. Not understanding drug interactions can cause serious side effects. But here's the good news. Most of these errors are completely preventable. They happen because of confusion, not carelessness. When you understand what's on that label, you take control of your health. What changed in recent years? Pharmacies have improved their labels significantly over the past decade. The American Medical Association and other organizations have pushed for clearer, more readable prescription labels. You might notice larger font sizes for critical information, better organization of the label, plain language instead of medical abbreviation codes, color coding in some pharmacies, highlighting of the most important warnings. However, labels still vary between pharmacies. What you see at one pharmacy might look different from another. That's why understanding the core components helps you no matter where you fill your prescriptions. Talk to your doctor about creating a complete medication list. Bring all your bottles to each appointment. This simple step helps your healthcare team spot potential problems before they happen. Now let's go through your medication bottle, section by section. I'll explain what each part means and why it's there. Section 1. Your personal information, top of the label. The very top of your prescription label contains information that identifies you and your prescription. Your name. This seems obvious, but always check it. Mistakes happen. If the name is wrong, the medication might not be yours. Never take medication prescribed for someone else, even if you have the same condition. Prescription number. This is a unique tracking number for your specific prescription. You'll need this number when you call for refills. Write it down or take a photo. Some pharmacies let you refill by text using this number. Prescriber's name. This tells you which doctor or healthcare provider ordered this medication. If you see multiple doctors, this helps you remember who prescribed what. It's important when you have questions about the medication. Pharmacy information. The pharmacy's name, address, and phone number. Save this number in your phone. You should feel comfortable calling with any questions about your medications. Date filled. This shows when the pharmacy prepared your prescription. This matters because medications expire. Most prescriptions are good for 1 year from this date, but liquid medications often expire sooner. Section 2. The medication name, brand, and generic. This section can be confusing because you'll often see two names. The brand name. This is the marketing name a pharmaceutical company gives the drug. Examples: Lipitor, Zocor, Norvasc. The generic name. This is the scientific name of the active ingredient. Examples: atorvastatin, simvastatin, amlodipine. Your label might show both names, usually with the generic name first in lowercase, followed by the brand name in quotes. For example, atorvastatin, Lipitor. According to the FDA, generic medications must contain the same active ingredient as the brand name version. They work the same way in your body. The difference is cost. Generics typically cost 80–85% less than brand names. Why both names matter? When you talk to different doctors or visit a new pharmacy, some might use the brand name while others use the generic name. Knowing both prevents confusion and helps you avoid accidentally taking the same medication twice under different names. Section 3. The dosage information. This tells you how much of the medication is in each pill, capsule, or dose. Strength. You'll see a number followed by units like mg, milligrams, mcg, micrograms, ml, milliliters, or IU, international units. For example, 10 ml or 500 mcg. Important, do not confuse mg and mcg. mcg is 1,000 times smaller than mg. Taking the wrong strength could be dangerous. If your doctor changes your dose, make sure you're taking the correct strength. Quantity. This shows how many pills, capsules, or how much liquid is in the bottle. For example, Q-Tie, 30 tablets, or 120 ml. Match this against what you receive. If you're prescribed 30 tablets but only receive 20, ask why. Sometimes insurance limitations affect what you get, but you should know about it. Section 4. Directions for use, the most critical section. This section tells you exactly how to take your medication. Read this carefully every single time. Typical directions include frequency, how often to take it. Once daily means one time in a 24-hour period. Twice daily means approximately every 12 hours. 3 times daily means approximately every 8 hours. 4 times daily means approximately every 6 hours. Every 4 hours as needed means you can take it when needed. But wait at least 4 hours between doses. Timing relative to meals. Take with food means take it during or right after eating. Food helps prevent stomach upset or helps your body absorb the medication better. Take on an empty stomach. Usually means take it 1 hour before eating or 2 hours after eating. Food can interfere with how your body absorbs these medications. Take with a full glass of water helps the pill go down and helps your body process it properly. Special instructions. Do not crush or chew means the medication has a special coating that releases it slowly. Breaking this coating can release too much at once. Take at bedtime usually means the medication might cause drowsiness or works best while you sleep. Avoid sunlight means the medication makes your skin more sensitive to sun. Wear sunscreen and protective clothing. What as needed really means. Some medications say as needed for pain or as needed for anxiety. This does not mean take it whenever you want. It means take it when you have the specific symptom following the limits on frequency. For example, every 4 hours as needed means you can take it when you need it, but you must wait at least 4 hours between doses. Section 5. Warnings and Precautions. These are usually printed in a box or highlighted section. They're there to protect you. Common warnings include, may cause drowsiness. This medication might make you sleepy or slow your reaction time. Don't drive or operate machinery until you know how it affects you. Be extra careful on stairs. Avoid alcohol. Alcohol can increase side effects or make the medication dangerous. This isn't a suggestion, it's a serious warning. According to the National Institute on Alcohol Abuse and Alcoholism, mixing alcohol with common medications can cause nausea, vomiting, headaches, drowsiness, fainting, loss of coordination, internal bleeding, heart problems, and difficulty breathing. Do not take with dairy products. Some antibiotics bind to calcium in dairy, making them less effective. Wait at least 2 hours after taking the medication before consuming dairy. Finish all medication. This appears on antibiotics. Even if you feel better, take every single dose. Stopping early can allow bacteria to develop resistance, making future infections harder to treat. Refrigerate. Some liquid medications need to stay cold to remain effective. Don't leave these out on the counter. Talk to your doctor if any warning concerns you. Don't simply stop taking a medication without medical guidance. There may be ways to manage side effects or alternative options available. Section 6. Expiration date. This date is usually printed near the bottom of the label or on the bottle itself. The format varies. EXP 1025 or expires October 2025. Why expiration dates matter. Medications break down over time. After the expiration date, the medication may not work as well, or in some cases can become harmful. The FDA states that expired medications can be less effective or even risky due to chemical changes over time. For what to do with expired medications? Don't just throw them in the trash where children or pets might find them. Many pharmacies and police stations have medication take-back programs. You can also check with your local waste management department for safe disposal options. Section 7. Refill information. This section tells you how many refills remain and when you can get them. 5 refills remaining. This means you can refill this prescription 5 more times without contacting your doctor for a new prescription. No refills. You'll need to contact your doctor for a new prescription when this runs out. Do not refill until insurance companies often limit how early you can refill. This date protects you from running out too early. Pro tip: request refills when you have about 1 week of medication left. This gives you time to resolve any insurance issues or contact your doctor if refills aren't available. Section 8. Special storage instructions. Some medications have specific storage needs beyond the standard keep out of reach of children. Store at room temperature. This typically means between 68 to 77 degrees Celsius, 20 to 25 degrees Celsius. Don't store medications in bathrooms where heat and humidity from showers can damage them. Protect from light. Keep the medication in its original bottle, away from windows or bright lights. Keep in original container. Don't transfer to weekly pill boxes without checking first. Some medications need protection from air and moisture. Section 9. NDC number. This is the National Drug Code, a unique identifier assigned by the FDA. It's a string of numbers usually found on the side or bottom of the label. You don't need to memorize this, but it's useful for confirming you received the correct medication if you question it. Reporting adverse reactions to the FDA, checking medication recalls. Talk to your pharmacist if you have any questions about any section of your label. They are medication experts and want to help you take your medicines safely. Now let's talk about what you can do right now to stay safe and organized with your medications. Create your personal medication list. Sit down with all your medication bottles and create a master list. Include full medication name, brand and generic, strength and form, 10 mg tablet, 5 mg liquid, prescribing doctor, why you're taking it, exact directions for use, pharmacy and prescription number. Update this list every time anything changes. Keep a copy in your wallet and share it with your healthcare providers. In an emergency, this list could save your life. Questions to ask your pharmacist. Never leave the pharmacy confused. Here are questions you should always ask. 1. What is this medication for and how does it work? 2. When exactly should I take this? Morning, evening, with meals? 3. What should I do if I miss a dose? 4. What side effects should I watch for, and which ones require calling the doctor? 5. Does this interact with my other medications or supplements? 6. Are there foods, drinks, or activities I should avoid? 7. How will I know if this medication is working? 8. How long will I need to take this? Write down the answers. If you're picking up multiple prescriptions, ask about each one separately. Set up a safe medication system. Choose a system that works for your routine. For once-daily medications, take them at the same time each day, perhaps with breakfast or at bedtime. Set a daily alarm on your phone. For multiple daily doses, use a weekly pill organizer with separate compartments for morning, noon, evening, and bedtime. Fill it once a week at the same time. For as-needed medications, keep these separate so you don't accidentally take them as part of your regular routine. What to prepare for doctor appointments. Bring these items to every appointment. All medication bottles, prescription and over-the-counter, your medication list, list of supplements, vitamins, and herbal products you take, questions about your medications written down, tell your doctor about, side effects you're experiencing, doses you've missed and why, any medications you've stopped taking, financial difficulties affording medications, problems swallowing pills or remembering doses. Talk to your doctor before making any changes to your medication routine. This includes starting new vitamins or supplements, which can interact with your prescriptions. Resources for additional support. Ask your pharmacy about free medication synchronization, getting all your prescriptions filled on the same day each month. Check if your pharmacy offers large print labels. Inquire about automatic refill programs. Ask about medication therapy management, MTM services, which many insurance plans cover for seniors taking multiple medications. Let's recap the most important points from today. First, always read your medication label carefully each time you take a dose. Don't rely on memory. Labels contain critical information about timing, dosing, and warnings. Second, know both the brand name and generic name of your medications. This prevents dangerous duplication and helps you communicate clearly with all your healthcare providers. Third, understand the directions completely. If anything is unclear, timing, food interactions, what as needed means, call your pharmacist immediately. Never guess. Fourth, respect expiration dates and storage instructions. These aren't suggestions. They're safety requirements. Finally, create and maintain a complete medication list. Share it with all your doctors and keep a copy with you at all times. Remember, every person is different, and what works for one person may not be right for another. Always discuss any changes to your health routine or concerns about your medications with your doctor before making them. Your medication bottles contain the information you need to take your medicines safely. Now you know how to read them confidently. If you found this helpful, subscribe to Senior Vitality Clinic for more evidence-based health education. Stay safe, stay informed, and take care of yourself.